Hi, my name is Nilesh Anand. I'm an anesthesiologist and pain medicine specialist, and I'm the director of the acute pain service here at Valleywise Hospital. The acute pain service is a service line offered by the anesthesiology department that aims to provide pain medicine care for people who are recovering from surgeries or recovering after traumas. Two of the primary ways that we help with pain management are through nerve blocks and nerve block catheters and epidurals and epidural catheters. If you have a patient with a nerve block catheter, which can be located in the arm, leg, abdomen, or back, there's a few things that you need to know. First of all, you need to check the site daily. You want to make sure that the site appears clean, dry, and intact, that the dressings are intact, that there's no liquid leaking from the sides. The second thing is you want to look at the skin near the catheter. You want to make sure that the skin is not red, it doesn't appear infected. Lastly, what you want to do is you want to make sure that the catheter system is intact, so that the catheter is connected to the tubing and the tubing is connected to the pump. So this patient has a right-sided sciatic nerve catheter. It's located in the back of the right leg. You can see that there's a catheter here. It connects to tubing, and this is connected to an on-cue pump, which is this ball of local anesthesia reservoir, which goes to the patient. Ensure whenever you have a patient with an on-cue pump that this clamp is open. Right here, you'll see the rate controller, which determines how many mLs per hour of local they're getting. And then also make sure that this is tight and not leaking. The second type of catheters we place are epidural catheters. We place the epidural catheters in either the thoracic or lumbar spine. Every time you have a patient with an epidural catheter, you need to check the site daily. So you want to have the patient sit up, you want to look at the spine, you want to look at the site, make sure that the tape and the site and the dressing is intact. Make sure the skin at the catheter site looks clean. There's no redness, there's no signs of infection, there's no signs of bleeding. You also want to make sure that the actual catheter is securely tightened to the tubing here. The catheter is going to be attached to epidural tubing. This type of tubing is just used for epidurals. Nothing else should be ever injected into this tubing. The epidural tubing is connected to an epidural pump, which will tell you the continuous amount of medication the patient's getting, the bolus amount they are getting through the PCEA, the patient-controlled epidural analgesia button, and then also it will tell you how much medication is left over in the medication bag. So the patient will often also be given what's called a PCEA, the patient-controlled epidural analgesia button. That's what we see here. We preset the amount of medication the patient gets with each button click to make sure it's a safe amount. And we also will educate the patient in how often they can get that. If they prick the button, they're going to get a specific amount, and it will hopefully improve their analgesia as a result. Epidural catheters and infusions can sometimes cause leg weakness, especially if they're in the lumbar spine, so care should be taken about letting the patients ambulate. Also can sometimes cause urinary retention, so urine output should be monitored. Again, any patients that have epidural or peripheral nerve catheters are going to be managed by the acute pain service. We're going to round on these patients every single day, including the weekends, and making sure the patients are doing well. So if you have any questions about any patients that are having these catheters placed, just give us a call, and we're happy to help out.